New details tonight after a person suffered a severe allergic reaction to the Pfizer coronavirus vaccine. The Alabama Department of Public Health says that person received the vaccine at Decatur Morgan Hospital. WAAY 31's Sophia Borelli spoke with Dr. Karen Landers. She found out what you need to know about getting the vaccine and more about the risk of getting a reaction.
It's very rare with vaccines, but it can happen, and we do know that it has been reported in very small numbers.
More than 15,000 people have received the coronavirus vaccine in Alabama. So far, this is the first case of a severe allergic reaction to the vaccine in the state. According to the Alabama Department of Public Health, the patient at Decatur Morgan Hospital had a history of severe allergic reaction to biologicals, but after a risk assessment, decided to receive a dose of the vaccine.
Remember, no one's ever taken COVID-19 vaccine until recently, so we would not know if they had a history of allergy to COVID-19 vaccine because, again, this is the first time we have ever administered this in the United States. But if you have a previous history of anaphylaxis to another biological, this is what is categorized as a precaution. And by that, persons need to be aware that there is a potential risk of allergic reaction.
Dr. Karen Landers said that this is why after someone gets the vaccine, there is a period of time when the person is monitored to see if they have any reactions.
Also ensure that persons understand that if they have no history of allergic reaction, they need to be monitored for 15 minutes after administration, but 30 minutes if they have a history of anaphylactic reaction to other biologicals.
She says the patient was treated immediately and says even though there is a risk, it should not deter someone from getting the COVID-19 vaccine. We do know that patient is in stable condition. In Decatur, Sophia Borelli, WAAY 31 News.
Across the U.S., there have been 6 people who've had an allergic reaction to the vaccine.